Did you know that ketamine, yes, the recreational drug often used in club scenes, is now one of the most promising treatments for severe depression? Patients who have struggled for years with treatment-resistant depression are now finding relief within days and sometimes even hours. Hi guys, I'm Dr. Kidd, a board-certified family medicine physician, and in this video, I'm going to walk through everything you need to know about ketamine nasal sprays in the treatment of depression, specifically the FDA-approved version called Esketamine or Spravato. What we're going to cover in this video includes what esketamine is, how does it work in the brain, how effective is it actually in treating depression, how do you take it for the best results, and what are the key side effects to look out for? So what is esketamine? Esketamine is a derivative of ketamine and has been used as an anesthetic for decades. While traditionally ketamine has been used off-label to treat depression, esketamine or Spravato is the first FDA-approved ketamine-based substance for the treatment of treatment-resistant depression or depression with suicidal ideation. So how does ketamine work for depression? Unlike traditional antidepressants that target serotonin and norepinephrine, ketamine works on the glutamate system. Specifically, it blocks NMDA receptors in the brain and increases brain-derived neurotrophic factor, which promotes neural growth. This is thought to improve synaptic connections between nerves and may reset certain neural pathways involved in depression. The different mechanism also explains why esketamine can work quite quickly, within hours or days, compared to traditional antidepressants that can take weeks or months. So does it actually work for depression, and how efficacious is it? Well, the Transform studies, which were phase 3 trials, show significant improvements in symptoms of depression with patients taking esketamine plus antidepressant versus those that took only placebo and antidepressant. Approximately 70% of patients show significant improvement in symptoms within 4 weeks, and 50% of patients achieved remission. Esketamine also reduced relapse rates down to 26% compared to 45% with placebo. Additionally, many patients reported improvement in symptoms within hours or days compared to 4 to 6 weeks for traditional antidepressants. Further studies also show that esketamine plus standard of care significantly reduced suicidal thoughts compared to standard care alone. So at the time of recording, the studies that have been done so far have been quite promising. However, one thing to note about esketamine is that it has only been approved as an adjunctive treatment with antidepressants. It has not been approved as a solo treatment for depression. So how do you actually take the nasal spray? The Spravato treatment protocol is quite specific. It can only be administered in certified healthcare settings under direct supervision. Patients self-administer the nasal spray while being monitored. In the initial phase, patients receive twice weekly treatments for the first month, and in the maintenance phase, they receive once weekly for the second month, and then after that, it can be once weekly or once every 2 weeks. Patients must be monitored for at least 2 hours after administration, and patients cannot drive on the day of treatment. So what are the side effects? Well, common side effects include dissociation or feeling detached from reality, dizziness, nausea and vomiting, increased blood pressure, sedation, or feeling spaced out. Most of these side effects are temporary and resolve within 2 hours. Ketamine can also be addictive, but the risk of addiction is considered low when administered in a controlled healthcare setting. So who are the ideal candidates to use esketamine? Ideal candidates are patients that have treatment-resistant depression and have tried at least 2 antidepressants but have failed, and patients that have major depressive disorder and significant suicidal ideation. People who should not take esketamine or the contraindications are a history of aneurysms or arterial venous malformations, a history of intracerebral hemorrhage, which is bleeding inside the brain, pregnancy, and a hypersensitivity to either ketamine or esketamine in the past. Another key thing you need to know about esketamine at the time of recording this video is that the medicine is quite expensive. For example, in the US without insurance, each session can cost up to $600 to $800 per session, and the total cost of the first month of treatment can be up to $5,000. So in conclusion, esketamine nasal spray represents an important advancement in our treatment options for depression. Its rapid onset of action and different mechanism provides hope to many patients. However, it's not a silver bullet. Currently, it is only approved in conjunction with an antidepressant. In addition, it requires commitment to a strict protocol, careful monitoring, and consideration of costs. So if you found this video helpful, don't forget to like and subscribe to the channel. It'll help me make more content like this. If you're interested in learning about an antidepressant that has virtually no side effects, check out this video here on agomelatine, and I'll see you in the next video.